Ebola is a disease that was discovered back in the 1970s. It is a virus that right now is running at epidemic proportions over in 4 countries in Africa, and unfortunately has made its way to the United States.
As soon as you start to feel sick, it's the same period when you're infectious. So the reason that there have been many outbreaks and it's never really traveled very far and lots of people have not gotten sick is because generally what happens is the disease burns itself out. The people that are infected are so sick, they can't travel, they can't move around, and the disease tends to be confined to a small area.
What we did, interestingly enough, at the very beginning of the semester, before the semester started, we spoke to the Office of International Studies because we knew that we had a population of students coming in from some of those identified countries in Africa. So what we did was put together a plan of action for how we would address it as they were welcome to the campus in the fall.
Check out our Ebola webpage at uakron.edu to find out exactly how the University of Akron will continue to keep our students aware.
We are well aware of what's going on, that we are keeping up with the CDC and the Summit County Health Department, as well as the Ohio Health Department guidelines on what to do in the case of this illness that is now spreading in the United States.
The County Health Department has set up a hotline to answer questions concerning the Ebola virus. Call 330-926-3939 for more information.
The reason that we're scared of Ebola is that we don't understand it, but there have been people working on it for 40 years. They have a facility in Atlanta where they've been doing research on it for 30 years.
So now, within the last couple days, obviously we've been confronted with something that is occurring a little bit closer to home with the unfortunate nurse that did happen to contract the virus while caring for a patient.
The people that came into contact with the patient who came to visit Akron, they've all been quarantined. If you look at the patient that died in Texas, his girlfriend hasn't got Ebola and she's been past the 21-day window now. So you have to have a very close personal contact with those people to get to the disease, and it's not on campus.
There is no Ebola in Ohio. That's something that we are putting out to the campus. There is no Ebola. We're very confident in that. We're watching the CDC and what they're doing. We're watching the health department, their guidelines coming out. And if anybody on our campus feels like they are at risk, then they need to contact us. And then we will monitor the situation, and it is all very individual.